Hi guys, welcome back to my channel Made Simply Easy. In this video we're going to see about the factors affecting growth and development. Fetal growth. It is influenced by fetal, maternal and placental factors. Fetus has an inherent growth potential to grow into a healthy, appropriate size newborn under normal circumstances. The other factors affecting growth and development are in postnatal period and also social factors. Genetic potential. Intrauterine growth is influenced by genetic potential of fetus with environmental and nutritional factors acting as modulators. There is strong correlation between maternal weight and height with the birth weight of newborn. And sex of the child also influences the height and weight. For example, boys are taller and heavier than girls at birth. Fetal hormones and growth factors. Insulin is produced by fetal pancreas in response to the nutrient supply. IGF-1 and IGF-2 is produced by placenta. Now T3 is converted from the maternal free T4, which is required for neurodevelopment. Now, even though fetal thyroid production begins at 12th week, it is produced at low levels. That is why maternal free T4 is required. And glucocorticoids are required for maturity of lungs, liver and GI tract. Growth hormone is present in high levels in fetus, but it is not a major influence on growth. Placental factors. Fetal growth depends on structural and functional integrity of placenta. With advancing gestation, placenta size increases to cater to the baby's increased needs. Maternal factors. Mother's own fetal and childhood growth, mother's current weight and height, mother's nutrient intake. If there is any deficiency, then it could also lead to anemia and malnutrition. If it was a teen or advanced pregnancy, recent pregnancy and high parity retards fetal size. And obstetric complications during the pregnancy such as PIH, preeclampsia and multiple pregnancy restricts the fetal growth. And if there is history of any chronic systemic diseases such as CKD and congestive heart failure. And maternal infections such as rubella, syphilis, hepatitis B, HIV, CMV and toxoplasmosis. And maternal intake of tobacco, drugs or alcohol retard the fetal growth. Obesity also increases the risk of gestational diabetes, hypertension and preeclampsia. Now the factors affecting growth and development in the postnatal period are genetic factors and IUGR. So in genetic factors, it could also include chromosomal disorders and mutations such as Turner syndrome, Down syndrome, which can have growth retardation, and there are also single gene disorders such as Prader-Willi syndrome and Noonan syndrome. And tall stature is seen in Klinefelter syndrome and Sotos syndrome. Now intrauterine growth restriction results in low birth weight, which indicates postnatal malnutrition and poor growth of the newborn. So low birth weight and faulty complementary feeding practices, poor hygiene, infections, all lead to underweight, stunting or wasting in the first 5 years. And the other factors which affect the growth and development in the postnatal period are hormonal influences, such as the absence of growth hormone and thyroxine results in poor linear growth. Androgens and estrogens are responsible for the growth spurt and final adult height. And the sex of the baby, such as girls attain pubertal growth spurt earlier than boys, but boys attain peak height velocity higher than girls in puberty. Nutrition. uh, Protein energy malnutrition, anemia, vitamin A and D, calcium, iron, and zinc, and iodine deficiency can be seen. And obesity increases the somatic growth, but there is no effect on final height. Infections. Persistent or recurrent diarrhea, upper respiratory tract infections, or and lower respiratory tract infections, systemic and parasitic infections can also affect growth during the postnatal period. Trauma. Now, fracture at the end of bone damages the growing epiphysis and also affects the skeletal growth of the newborn. Social factors. Socioeconomic level. Now, high socioeconomic status indicates better nutritional status, fewer infections, and hygienic living conditions. Poverty indicates hunger, undernutrition, and higher risk for infections. Now, if there are natural resources available, it improves agriculture and nutrition of the region, and this increases the gross national product and per capita income of the family. Now, climate is also an important social factor because the growth velocity is higher in spring and low in summer, and infections are common in hot and humid climate. Climate has a pivotal effect on agricultural productivity and ready availability of food. Emotional factors are broken homes, orphanages, anxiety, and lack of emotional support or love. Cultural factors are each community has its own method of child rearing and infant feeding, so uh, which is all grouped under the cultural habits. Now, parental education such affects the health promoting behaviors during childhood. Thanks for watching. Subscribe for more such videos and check the Pediatrics playlist for other videos. And let me know your suggestions in the comment box below.